I love taking care of the patients. I love the families. I love the adrenaline rush that you get working in the critical care. I took care of many heart attack patients.
Lynnette Anderson considers being a caregiver her calling. She was a nurse in critical care for 20 years, as well as an EMT for 15. Back in September 2013, her life was moving at a rapid pace. Her youngest daughter just started college. Her oldest was getting ready to be married.
You're busy. Everybody has a yard and a farm and a garden and all that to take care of.
Like many North Dakota farm families, they were getting ready for the bean harvest.
It was a weekend and I was cleaning windows, washing windows, doing some gardening, doing some yard work. And my left arm was aching. I would have rated it a 4 on a 0 to 10 scale.
Lynnette didn't think twice about the pain.
More of an annoyance than an actual pain. On and off all weekend, all Saturday and all Sunday. I'd stop what I was doing and try to rest, take some Advil, take some Tylenol. Nothing really seemed to help, but it didn't really interfere with me continuing to work.
But then her husband Rick started to get worried.
More than once over the course of the weekend, my husband was like, do you think you could be having a heart attack? And I said, no, there's no way that this is a heart attack.
She was 47 at the time, no family history of heart disease, no overt symptoms.
And as a nurse, I went through the list of every book type heart attack, what your symptoms would be. I was not short of breath. I was not sweaty.
The pain continued to come and go. At one point, they almost made the trip to the hospital, but decided not to.
My husband commented and he said, I just heard a commercial on the radio this week, how women your age have atypical symptoms and they have vague symptoms. So he said, are you sure? And I'm like, no, it's fine.
Monday morning, Lynnette made the 50-mile commute from Page, North Dakota to her office in Fargo. In the door by 8 a.m., she made a doctor's appointment just 2 hours later.
And I was able to get in at 10 o'clock.
A surprise to her because her doctor usually has a long waiting list.
I got to the clinic for my appointment. He, of course, checked me over and he did an EKG. And at that time, it was showing that I was having a heart attack. He came in and he showed me what it looked like, and he contacted the cardiology crew. And he said, we're gonna need to put you in an ambulance and we're gonna take you directly to the cath lab.
She still wasn't convinced.
I'm like, well, this really can't be happening. I get that they're gonna do that, but this can't be happening to me.
It wasn't until the doctor gave her nitro, a medicine to increase blood flow to the heart, that her life came to a complete stop. As a nurse, she knew that was the preferred treatment for a heart attack.
That was like the first aha moment for me. I was pretty much in denial all weekend if anything was happening, and I truly didn't believe that that's what was going on. And I'd been having a heart attack all weekend and was just very fortunate to have gotten to Monday.
One of the toughest moments for Lynnette had nothing to do with procedures or doctors. It was breaking the news to her family.
I was composed and I was doing fine. Until I called him. I was very vulnerable. We didn't know what was going to happen. But I think I was just plain scared.
And she had reason to be.
Cardiovascular disease kills more men and more women than anything else. You can be developing artery disease and not really have any signs or symptoms that it is happening. This can happen to anyone. The biggest problem that I think comes with cardiovascular disease is that many people labor under the idea that it is something that happens to someone else.
Lynnette spent 20 years as a medical professional. She never thought she would be the patient.
So it can be quite deceiving, because even as a nurse and an EMT, when you think somebody's having a heart attack, you think they're going to be clutching their chest and having a hard time breathing, and that just was not the case at all.
I was kind of in charge of calling everybody, which everyone I called, I would say, Mom or Lynnette is in the hospital, she's in the cath lab, we're waiting to hear from the doctors. And I had to repeat myself at least 2 or 3 times with everyone I talked to, because they're like, who? Your mom? Lynnette? What did you say?
I looked like I look now. I mean, nobody would have known to look at me. I was not in distress. I was not having difficulty breathing. None of that.
I think it finally hit me that my mom was actually the patient when we went back and saw her in the bed.
I had to come to terms that I was 47. I'd had a heart attack, and I felt like a total failure.
I kind of just thought about it, and I was like, my mom had a heart attack. She was 99% occluded, and I was like, I could have easily lost her. It didn't hit me until a few days later.
I felt like I failed my family, and I failed my friends, and I, most of all, failed myself.
Her doctor reminded her that she was given a second chance.
He said, this is normal. He said, you have to wrap your head around the whole concept that you now have coronary artery disease and you've had a heart attack, but you survived.
At age 60 and above, women are at a greater risk for a heart attack. Lynnette was 47.
No, so, I'm trying to think back, and there was just no other indication.
As far as cardiovascular risk factors go, there really was not a lot to speak of in terms of things that would have said when you looked at her or talked to her before her heart attack, yes, this is somebody who we have a really high suspicion is going to have a heart attack in the next year.
I was aware of my blood pressure. I knew what my blood pressure was. I knew what my cholesterol was. I'd had my annual appointments. Is there anything I could have done differently? Eaten better, exercised more. I think the biggest thing with me was stress. I have a very type A personality. The physicians tell me now that probably my biggest warning was the fatigue and being tired. But again, who runs to the physician or runs to an appointment, runs to see the doctor because you're tired?
Lynnette spent over 3 months in cardiac rehab, but it wasn't easy.
My recovery was like going through the grieving process. I denied up to the point where I couldn't deny anymore.
A lot has changed since then. She's now a grandmother and is getting used to what she calls her new normal: medication, a healthier diet, and more exercise.
I've realized that life is short. Life is precious, and don't sweat the small stuff. That's kind of an old saying, but it is so true.
Lynnette is, I think, a very typical person of many people who are walking around in their life. They're working, they have families, they have active lives. They're not necessarily unhealthy, and they're not necessarily somebody who's completely unaware of their risk factor profile, but yet despite that, she absolutely did have an event.
I feel as a mom and a wife and a daughter that we take care of everybody else first, and we put ourselves kind of at the bottom of the list. And I've had to move myself up the list. So mentally and emotionally, I'm good. Physically, it's a constant, but I feel good. I go in regularly, I get my numbers checked, I'm watching my blood pressure and my cholesterol.
Lynnette says her calling now is sharing her experience, even if it only encourages one person to check in with their doctor.
Just to be able to impact change, or help somebody realize that it's okay. But truly how important it is to know your own body, know your health, take care of your body and take care of your health. Because it is a fragile thing, and it can change at any time.
I'm always on everybody about how to eat better and things like that, but I can always improve myself, and with having that family history now, we're at a higher risk.
If it happened to me, it can happen to anybody else. I just feel like because I was allowed, and I'm honored to still be here, then I need to share my story with people.